Hello and welcome to the update from the board meeting in May. As always, this is a chance for me to give you some keynotes back from the board meeting which we held this month. First of all, at our board meeting we had a patient story from Mandy Carney, the matron in the emergency department, who fed back to the board about a story concerning a patient, particularly complex patient, that required a lot of multi-agency support and coordination before they were admitted to hospital. It was really interesting to hear how potentially we could have avoided this admission in the first place through a different way of working, and looking at how we could have perhaps gone out from the hospital to provide services in this patient's own home, given the complexity of their situation, and how, however, we managed very ably when the patient was actually brought in to be cared for in the hospital. It highlighted to the board a number of concerns and opportunities around how we coordinate care for our patients in a better way with our colleagues in the community, with GPs and SWAFs, and certainly gave a real indication as to why the work we're doing through our Symphony project, looking at how we integrate care across the health community, is so important to us in terms of moving forward as an organisation. In my Chief Executive's update to the board this month, I provided an update on where things were at with the stroke review that's currently going on across the county. As many of you may know, the CCG, the Clinical Commissioning Group, have been doing a review for a while now, looking at whether there was a case to centralise stroke care at Musgrave Park Hospital in Taunton. We feel very strongly that the stroke care we provide here at Yeovil is of good quality, and if you look at both the patient feedback about our service and the statistics around outcomes for our patients with stroke, we provide a really good service here at Yeovil, and we've been working very closely with the CCG to make sure that our point of view is very much taken into account. We've also looked at how we could develop a collaborative model with Taunton so that actually we could keep two centres of stroke in Somerset, but look at how we use our staff, particularly our consultant staff, more collaboratively across the two sites. The CCG are currently in the final process of pulling together a report of their recommendations and options, and that will be considered by the CCG's governing body on the 4th of June, and we should have an indication at that point as to whether the proposal to move ahead with a single stroke service in Taunton is going to go ahead or not. So we will obviously update as soon as we hear any information about that. The second item we talked about at the board was our capacity in CT scanning. We have one CT scanner here at the hospital at the moment, and it's very, very used as CT becomes more and more the diagnostic of choice for a number of specialties. And we've recognised that there is a real need to think about our capacity and the opportunity for a second CT scanner to be brought in to improve our capacity and also to provide more resilience to our service. The radiology department worked really hard to look at a variety of options of how that could be resourced and funded, and we've agreed as a board and as a management team that we would go ahead and procure a second CT scanner for the organisation. We're looking at funding that from a variety of sources, from charitable funds. So we've been fortunate enough that our League of Friends have offered to put money towards that. Our research and development team have offered some of their charitable funds as they use the scanning capacity in CT. And our aim is to be able to fund the new CT scanner, which is about £180,000, entirely from our charitable funds. So this isn't new money that's been found from within the organisation. This is particularly money that we've found from our charitable funds, which is really, really an important investment in our diagnostic capabilities within the hospital. Helen, our Director of Nursing, gave an update to the board, particularly focused around some of the new requirements around safe staffing levels. As many of you will know, there's nationally guidance currently out to consultation by NICE around safe staffing of registered nurses to the number of patients, and obviously we're waiting for final feedback around that. But also, we're being asked now to collect information on a monthly basis about the number of nursing shifts hours we have resourced at a ward level versus the number of nursing shifts that we're actually able to fill. So that would take into account things like sickness absence, vacancies and things like that. That data is going to be collected at a national level, and there will be indication on NHS choices published on the 24th of June, so that every trust will have a number against it to show what they call the fill rate, i.e. the percentage of planned hours on a ward versus the actual number of hours of nursing time on a ward. That will be published on NHS choices and indicated whether that's a good performance or not good performance. It's a big challenge for us in terms of collecting the data, and I think absolutely we recognise this is about us being open and honest with our local community and patients about our any challenges we have in terms of staff in particular ward areas. And we'll be obviously working very closely with our nursing teams to make sure the data we're collecting is as accurate as possible and as timely as possible, but also making sure that when the data is published that we are working very closely with the local media and others to help explain what is quite a complex set of information to the local media, so that there is no misinterpretation of the data that gets presented. In terms of our finance report, Tim Newman, our Chief Finance Officer, gave an update on our financial position. As you know, the budget position for this year is particularly tight, and we are forecasting currently that we will be in a deficit position this year. And Tim was able to also update with the early indication around how our first month numbers have gone in April. It's fair to say this has been a particularly challenging first month of the year because of the increased activity we're seeing through the hospital and the costs that have been incurred in terms of keeping our escalation space open. And there was a significant amount of conversation at the board about how we were going to manage that going forward. But overall, a real commitment from the board to make sure that the financial position had a continual focus, whilst also balancing the need to make sure that we continue to provide safe and effective services to our population. We also had an update from Mark Appleby, our Head of Workforce, on our current performance around mandatory training and appraisal. And again, this is an area I know we've talked about many times at the board. Unfortunately, our mandatory training is still not quite where it needs to be, so I'd really encourage everybody to have a focus on making sure that the mandatory training is updated, and information is going to be available soon on the intranet on YCloud for everybody individually about where they're at with their mandatory training. And also appraisal rates are improving, and again our appraisal process has now moved on to YCloud, so it's all electronic to make it a lot easier for staff and managers to complete their appraisal. So I'd really encourage everybody to make sure that they are getting their appraisals done, and also to undertaking their mandatory training, which is really important that staff across the hospital have the right level of training and expertise to do the jobs that we're expecting them to do. Finally, in the afternoon of the board, we were able to invite a number of our junior doctors along to meet with the board, accompanied by Dr. Rachel Johns, who is one of our clinical patient safety leads, and Joe Howarth, Associate Director of Patient Safety and Quality. And our junior doctors have been doing a lot of work over the past 12 months, looking at how they could improve particular areas around patient safety across the hospital. And this was an opportunity for the juniors to come back and present to the board the projects they've been working on and the improvements they've seen and implemented in a number of areas. Just for examples, a group of the juniors had been looking at how our twin bins were laid out on the wards to make it easier for them to find things when they need to do some of the simple procedures that need to be undertaken, such as taking bloods. And there was some really interesting work that they've done to improve the layout in the twin bin to make it quicker and more efficient for them to find things when they need it. Also, another group were looking at the fluid balance charts and how could those be adapted and improved to make them as useful as possible for both medical and nursing staff. So these were really practical patient safety improvements that the juniors had taken on board and made improvements in. And it was really encouraging to see the work that they'd done, the enthusiasm with which they'd tackled these projects, and the improvements that they were already able to evidence as a consequence of their interactions. So the board were really encouraged and enthused by what they saw, and we're looking forward to our new set of juniors who arrive in August, undertaking a similar piece of work in the next 12 months under a quality improvement programme. And what Joe and Rachel are also looking at doing is how could that project be expanded to include not just junior doctors, but other members of the nursing team, the AHPs, across the hospital, so it becomes more of a multidisciplinary project, as well as focusing on some of the specific issues that the junior doctors have. But again, a really good opportunity for that group of staff to have the chance to come and talk to the board about what they're doing, and recognise for the board the important role that juniors have in the care of our patients on a day-to-day basis. So overall, that was the board day, a very full day, a really interesting day for all of the board. As always, if there's any particular questions or points you want to raise, please feel free to get in contact with me or through the communications team, but we'll look forward to giving you another update on the June board at some point in June. Thank you very much.